Hi, I'm Dr. Natalie Marks, and I'm proud to be here with you as we bring together the leaders in the veterinary industry to share the latest information and guidance for veterinary professionals as we face this unprecedented time during the COVID-19 pandemic. Stay with us for the next hour as we hear from the Viticus Group, presenters of WVC, the North American Veterinary Community, presenters of VMX, the American Animal Hospital Association, the American Veterinary Medical Association, as well as many others. Let's kick things off with the two leading epidemiologists in the veterinary field.
Joining me is Dr. Jason Stoll. He's an assistant professor at the University of Prince Edward Island and a veterinarian with unique knowledge and expertise in the areas of epidemiology, public health, and infectious disease. Thanks so much for being with us.
Thanks for the opportunity.
We have a lot of uncertainty today, as all of us know in the veterinary profession, and I know you have quite a few really helpful guidelines and tips for keeping our teams and our patients and our clients as healthy as possible. But I think the first thing we want to focus on today is our teams themselves. How do we go about keeping our teams healthy, both physically and mentally?
Perfect. So the first thing is think people, right? So we know this disease is transmitted by close contact with people who are sick. So we want to do everything we can to ensure that our team members have limited contact, ideally no contact, with sick people. So thinking about the ways, our protocols for how we're handling owners that are coming in, screening owners before they come in. We really want to try and ensure that those individuals and their pets as well aren't coming directly into our clinics, and so we can safely address these concerns and deal with these. There will be times, of course, where pets need to come in when they're sick, and just taking appropriate precautions to ensure that we're not having contact with those people. We also need to think about what this is doing on our staff. So staff morale is probably not very good right now. Staff are emotionally worried. In some ways, we can use the word panic, right? So we're watching things that are happening. So really being in tune with what your staff needs in terms of self-help, in terms of mental health, and in terms of just general health. So really trying to concentrate on those key areas I think will be extremely important in the days and weeks to come.
And I think it's also important, as you mentioned to me, not only about the people, but just about getting back to the basics of how we keep our hospitals disinfected and how we keep our workplace safe. And so what are some guidelines that we can just rely on, foundational principles that will help us keep our environment as safe as possible?
That's right. And so as veterinarians, as people working in this industry, we have a background in concepts around infection control. We do it all the time. So rely on what you know and make it even better. So some things to think about. Hand hygiene, right? Cleaning our hands. Super important right now. This is a place where we want to really be emphasizing that. So washing with soap and water, using alcohol-based hand sanitizers if they're available. Certainly throughout the day, definitely after any contact directly with people or indirectly with people. So common touch surfaces. Cleaning and disinfection, another key area that we're hearing a lot about, right? This virus we know can survive for certainly hours, potentially a little bit longer, up to days on certain surfaces. So having a kind of looking at our clinic environment, thinking about those common person or hand touching surfaces, and those are places that we really want to address. So we want to make sure we have protocols for those areas. We want to make sure we have checklists for those areas so that they get addressed frequently throughout the day. Simple disinfectants, basic stuff will kill this virus. It's an envelope virus, very, very easy to kill. And then finally, thinking about screening. So I already talked a little bit about this, but developing and using a screening tool to ensure that the highest risk people, whether they're people that might even be sick in our own clinic, we keep them out of our clinic. We don't want them coming in, right? It's great to do work, but we don't want sick people coming in, as well as owners. We want to keep them outside. We want them not to ideally even come into our clinic and potentially contaminate surfaces.
And I think one of the big words that's being used right now is risks, right? So the risks of some of the population, the risks to our patients, our clients, to ourselves. What is so important about communicating this? I know we don't know every answer, but what should the leaders in the profession be doing right now to communicate this?
Well, you touched on an important part, which is we don't know everything. We can talk about what we know and just be as honest and open as possible. That's part of it. We really want to be relied on by our staff as being kind of a good source of information. So we need to differentiate the concepts of risk and risk perceptions. So risk perceptions is kind of what it's the concept of risk, but it's also all that emotional stuff that's with all of us. It's with your staff, it's with you, it's definitely with your clients and the public. We don't want to discount the emotional piece of this, all right? So people may make decisions that that really are related a lot to the perceptions of risk, so their concerns that they might have. And really, it's in order to address this concept, it's not just about education, it's about communication. So having open dialogues with your staff members, your clients, if you're interacting with the public, and having them tell you why they're worried and making them understand that it's okay for them to have those feelings. Those are emotions they have, but then trying to put some of those maybe incorrect assumptions at rest. So what we know about, for instance, animals, the vast majority of these animals that we're dealing with on a day-to-day basis are completely safe. We don't need to be worried about that. The person that owns an animal doesn't need to be worried about what their animal is going to give them or that their animal is going to necessarily have a problem. It's these people that are sick. Then yes, we have to take some additional precautions, and mostly, again, the animals aren't going to get sick themselves, but we don't want to contaminate the animals. And you're going to, you I'm sure, have heard a lot of the different messages that are out there. It's just important that we enforce those messages and that we help people make sound, good decisions with having this dialogue, this communication back and forth.
Dr. Stoll, thank you so much for these very important and helpful guidelines for helping to keep our teams and our patients and our clients as healthy as possible. We really appreciate it.
Anytime, thanks.
Dr. Scott Wiese is a leading veterinary epidemiologist and a diplomate of the American College of Veterinary Internal Medicine. He's also the director of the University of Guelph Center for Public Health and Zoonoses.
Oh, thanks for having me.
Let's get right down to it. For so many of us out here on the front lines in the veterinary industry, there's a lot of questions we want to answer for ourselves, for our teams, and also for our clients. Question number one, can animals be infected with COVID-19?
A lot of things we don't know, and that's one we don't know well. We certainly know there are 2 dogs in Hong Kong that were owned by infected people that seem to be infected. We've been more concerned about cats based on what we know about the previous SARS virus and cats being able to be infected and infect other cats and ferrets. So I think at this point, we have to assume there's some potential. We don't know how common it is, and we don't want to overreact, but we have to assume that an animal that's had close and maybe prolonged contact with an infected person also has some risk of getting infected. It's probably low, but it's not impossible.
Okay. What about the other question, though? Can these animals, and in small animal practice, dogs and cats, can they be fomites for the human population?
Well, that's maybe a bigger concern, because if I have this virus and I'm in my house and I'm coughing and talking around my pet and I'm touching it with hands that are probably dirty, certainly there has to be deposition of virus on the hair coat. How long can it stay there is the big question. We know on some materials, plastic and stainless steel, it can survive for a couple days. Probably doesn't survive that long in a hair coat. It depends on the animal and how much grooming they're doing. But I think we have to go with some assumption that it could be there at least a few hours. So if an animal is coming from a household with an infected person, there probably is a window where there's some virus there. Whether it's enough to cause infection in us, we don't know. But it's one of these where if we can take some practical steps to reduce that risk, it's worth doing, because we'd rather overreact a little bit than underreact and put ourselves at risk.
Absolutely. So let's get to some of those steps, because I know a lot of teams around the country are saying, how do we practice veterinary medicine in a clinic and still practice social distancing, as well as keeping our teams safe? So can you offer some helpful guidelines for those practices?
Yes, it's really critical. Social distancing is the key. If you look at the models, that's the thing that's going to help us control this. We can't just focus on sick people or exposed people. We all have to do something. And that's a challenge, because we have to be able to maintain veterinary care. Now, it's important to remember that social distancing isn't isolation, right? What we're trying to do is reduce the number of human-human contacts and reduce the closeness of those contacts. And we can do a lot of things in a veterinary practice to do that. One of the most common things that's being done now is closing waiting rooms. So getting animals from the vehicle, having them drop them off at the front, some to the extreme where they're tying the animal to a hook inside the door, and then someone comes in after and gets it when the owner's gone. Now, what we do exactly depends on the clinic and parking lots and everything else, but trying to make sure that we minimize or eliminate contact with our owners. We can get histories by phone, we can get consent by phone, so we can still offer some degree of veterinary care, good degree of veterinary care, without having that human contact. A lot of other things that we can do, though. Telemedicine. This may be the revolution in telemedicine that's been waiting to happen, because there are things that we can do remotely with phone, with FaceTime, with Skype, that we can manage some cases very well. We can't do surgery by telemedicine, but there are certainly some cases that we can manage that way. Just reducing passing things back and forth. So not passing cash, using electronic payments, not getting signed consent, documenting verbal consent, anything we can do to reduce that contact point. Delivery of food and drugs. If clinics are decreasing elective care in particular, and they have staff that are available to deliver food, that prevents people from having to come to the clinic. It also helps us protect our high-risk populations. The more we can help our elderly and immunocompromised and other high-risk people stay in the house, the better. And that might be dropping drugs off, might be dropping food off. And if people need to get food for their animal, drugs for their animal, we want to maintain that. We want to maintain that animal's care by getting them on their proper diet, their good diet, their chronic meds. But we can do that by having them call in advance, and then we tell them when it's ready. They show up, they call when they get here, we pass it off at the door, you get electronic payment, and there's essentially no contact. If we can prevent direct contact and we can stay 6 feet away from people, the risk of transmission, even if one of us is positive, will be very, very low. Thinking about clinic operations, and I think one good exercise in a clinic is pick a random person in your clinic and pretend they got sick, that they got this virus. Who would they expose in the day or two before you realize they're sick, or if they had an asymptomatic infection? If that's everyone, then that's a problem, obviously, because we don't want everyone sick or being self-isolated. And I think more broadly as a profession, we need to show that we're being socially responsible, because there are a lot of discussions about what's elective and what's essential. And we need to maintain veterinary care as essential. What components are essential is a bit of a moving target right now. We're working on that. But the more we can say, okay, we're good, we're doing a good job, we're being socially responsible and delivering the best veterinary care we have, let us keep doing that. If we're not, we're putting us at risk of having someone saying, okay, here's what you're doing.
Dr. Wiese, thank you so much for all of your time today and these wonderful guidelines.
Thanks. Have a good day.
Dr. Heather Lenzer is the Senior Veterinary Officer for the American Animal Hospital Association. They accredit veterinary hospitals across the country on over 900 standards and are a leader in the protocols that we use in daily practice every day. Thanks so much for being with us, Dr. Lenzer.
Thanks for having me, Dr. Marks.
Let's get right to it. What has AAHA been doing since the COVID-19 pandemic has started to support the profession?
It's a great question. We've been marshaling resources and gathering experts together to share the most important information, most up-to-date information we can with our members. So we've been following the CDC, the FDA, and the AVMA's guidelines and leadership. We've also want to remind practitioners, regardless of whether or not you're AAHA members, that the 2018 AAHA Infection Control Prevention and Biosecurity Guidelines do remain an incredible source of information for your staff. So I would recommend checking those out at aha.org/biosecurity. In addition to those guidelines, though, we've been bringing the AAHA community together. We have a very vibrant Facebook community where we have been supporting each other. And the most important thing from a day-to-day life at AAHA is we have switched our in-person evaluations to now virtual. So just the same way the human education system has had to learn how to homeschool, virtually, we have been taking our evaluations into the field virtually as well.
That's good information to know. Now, you're an emergency clinician by training, and you've definitely dealt with stressful situations at work and clients that are coming in obviously very nervous and emotional about their pets. What advice can you give to veterinarians and veterinary teams that are working in these conditions where obviously our clients are dealing with more stress than normal? How can we deal with those clients effectively?
We need to be smart. We have incredibly solid training that I think sometimes we undervalue and underutilize. We know more about comparative medicine and infectious disease protocols than a lot of other colleagues do. So do fall back on your science. Do fall back on your medicine and your training. This is the time when all that hard work and all we can bring out the inner nerds in us to really keep the public and ourselves safe. We do have to stay calm, though. As leaders in the hospital, regardless of if we own the hospital or if we're associates,
we are looked at as leaders. So it's important to try to stay calm, creative, open-minded, and in the end, be very gentle with ourselves, because all of us are doing the best we can.
I totally agree. Now, we talked a little bit about the AHA standards and the virtual accreditations that are happening right now. What advice are you giving to practices that are AHA accredited right now in regards to doing the best thing that they can, even though the situation's changing daily?
Well, AHA hospitals, oddly enough, should feel great. They have actually achieved the standards and are following protocols that will help keep their staff and their clients and their pets safe. You're actually already doing this. So AHA hospitals should have peace of mind by following the protocols that you've already been adhering to. In general, though, do the best you can. Protect your staff, care for your pets. But do remember that as veterinarians, we have an oath. And that oath says that we swear to use our scientific knowledge and skills for the benefit of society through the protection of animal health and welfare. So we do have to measure and balance what we use and what we do for animals and how that extends into society as a whole. So it is not outside of our oath to be thinking about the human public health as much, if not more, than animal health right now, which is hard. That's hard for us, but it is in our oath.
And it's hard for everybody right now. And we were just kind of joking about, there's like we don't have enough stress in our lives. And
Right.
We're both working professionals and working moms. Any other tips that you want to give to people out there putting on a brave face, right? Because we're trying to lead and do the best that we can, but it's a really challenging time.
I think, we are all perfectionists, veterinarians are, and the idea that we can make a mistake can sometimes be paralyzing because we don't have the right answer right now. The right answer may not exist. So this is time to show a lot of self-compassion. And what that actually means is that if you make a mistake, instead of beating yourself up about it, think about how you would treat another person that you love if they made that same mistake. And chances are you would show them grace and compassion, and you would help them solve the problem. So do try to do that to yourself and model that with your teams, just so that everyone knows that doing the best you can in unprecedented circumstances is absolutely appropriate.
Dr. Lenzer and to AHA, thank you so much for your guidance and support at this difficult time. We really appreciate it.
Thank you for spending time with us today.
Dr. Marty Becker is, of course, a longtime veterinarian and the founder of the Fear Free Initiative. Thanks for being with us, Marty.
Thank you, dear friend.
In these challenging times, especially when we're thinking about reducing fear, anxiety, and stress, it's hard because our pets are feeling potentially our stress at home. They have increased anxiety, but they're still coming into our practices. So what advice can you give to our veterinary teams that are still seeing these patients and we're trying to make life as simple as possible right now?
We know now that pets have the same emotions that people do. For God's sakes, it took a decade for us to embrace multimodal pain management, that pets had pain just like people did. Many of us of my age were taught that they didn't. But people are stressed, pets are stressed, and now more than ever, I know, Natalie, you run a fear-free hospital, and it needs to start at home with these people. They need to start the process of if they can, a week out, if it's for wellness visits, which we need to continue to serve them. They don't baby talk them on the way in. They bring them in hungry. They play calming music on the way in. They start the magic carpet ride of pheromones. And what's funny, we've talked for 5 years in Fear Free about not having people come in and wait in the waiting area. But now what practices are even doing is coming in and checking in by phone that I'm here. They'll even take some of the history outside. But it worked for Fear Free, and it works for what we're seeing now.
And for us that are at the practices and on the front lines right now, what can we do so that we're not taking our stress home to our families and our pets?
I can't think of a better time in a way, to be a veterinarian. I used to work with NIH and the Surgeon General because veterinarians had more frequent friendly visits with people than their family practitioner. And often you think of family practitioners, they see your teeth, they see your eyes, they see you for allergy shots or vaccinations for kids, but they don't know your life. We know these people's lives. And so think of how they need us, not just the pets, but the people that need us. But I think almost like a first responder in a way, we can take great satisfaction in the fact that we are reducing fear, anxiety, and stress in pets. And then we can maybe take some of those success stories home and talk about the good things. Because I think our families, and I know I still practice, and my wife, sometimes you come back and it's a client that said no, or it's the one that couldn't afford it, and you had to, you weren't practicing best medicine, you were practicing on a budget, or this pet that you'd love for years passed on. But, I think it's a time to celebrate all these little successes that we see that, hey, I palpated an abdomen and I felt something. We caught it early on. We had a dog who was in extreme pain, and we got the tooth out, and it left with its tail wagging, still half anesthetized,
Yeah. And for those clients that are calling us and saying, my dog or my cat seems even more anxious than normal, I'm just at a loss. How can I help them at home and maybe start a new enrichment or teaching a trick? But what strategies can you suggest for us to communicate to our clients so we can make the best of what's going on right now?
I don't think too many people have had a doggy cam at home when they were working, so they really don't know their pets' routines. But I'll tell you a few things I think are really cool, because these pets are definitely going to see a different routine. And with a difference in routine often comes anxiety, because something is different. Start to counter condition them. Now when you go into the drawer to trim their nails, they know the room, they know the drawer. They don't even have to see the nail trimmers. But now you can start counter conditioning them, handle their feet, treat, handle their feet the next day, treat, handle the next day, treat, and then touch his toe, treat, and then you start doing one toe at a time. By the time this is over, you're going to have a dog that you can trim their toenails. And maybe that I've got more rolls in a Chinese takeout right now, and maybe it's a good time for me to start exercising with my pet, because he's put on a few pounds too. So we're going to tackle that. And you've been a great part of Fear Free, Natalie, and we thank you for that. And again, Fear Free Happy Homes, it's free to all pet owners. So anybody that's a veterinary healthcare professional can feel confident in recommending people that there is no cost, but it's filled with activities to reduce fear, anxiety, and stress, condition, counter condition, and for enrichment.
We really appreciate all these tips, Dr. Becker, and for what you're doing. And hopefully veterinarians and the professionals out there can be helping their clients make the best of what's ahead. Thanks for your time today.
Thank you, friend. Say goodbye, cutie. Say goodbye to all your friends. Your friends.
Dr. Dana Varble is the Chief Veterinary Officer of the North American veterinary community. Thanks so much for being with us today.
Oh, thank you so much for having me.
We have so much to worry about right now in our practices every day, but when we're home, we can be taking advantage of some of the opportunities for learning, and NAVC has really been a leader in offering some of these opportunities. Can you talk a little bit more about that?
Yeah, we're hearing a lot of people worried because conferences are getting canceled, meetings are getting canceled. Even those local weekend seminars that we relied on to get updates and new information, unfortunately, aren't being held in most cases. So we really want to start thinking more about how we're going to manage our CE online. And there's lots of options. Anything from the journals you receive every day, like Clinician's Brief, to Today's Veterinary Practice. A lot of those have CE options, and maybe we just didn't realize that before, or we just kind of set them aside. It might be time to pull out some of those old journals and see what's in them, but also check out their websites too. Remember that your online options are still available to you, and there's things like VIN and Vetfolio that are offering a lot of free options or some new options, or even doing live webinars just to keep us kind of up to date with all the things that are going on. And I know it's really different for us, and I think there's some concern too about, am I going to be able to get all my CE online? And the American Association for Veterinary State Boards, basically where we get race approval from, has actually reached out to state boards and is really advocating for them to relax their online CE requirements. So everyone should check with their state board, because chances are you can probably get more of your CE online than you ever thought you could.
So hopefully one less worry for all of us.
It should be really one less worry. And for those of you that are worried about cost, because I know right now everyone's very concerned about just how are we going to make ends meet? Things are getting cut. The good news is that a lot of these resources are free. And talk to some of your distributors, your pharmaceutical companies, your pet food companies. Some of the diagnostic labs have online CE that's free as well for you. So, it's time to kind of rethink a little bit of that, maybe pick some subjects that you're really interested in, or start making a list, as you go through your day to day, especially now we're going to see more emergency cases, right? If you're like, gosh, I just really want to get an update on feline infectious peritonitis, or I really want to hear more about oncology. What's the new stuff? Jot it down on a scratch paper, or stick a notepad to your wall. And then, when you're sitting around going, okay, today I was supposed to go to that weekend seminar and it got canceled. Flip to Vetfolio and start looking those things up that you maybe want to focus on a little bit. So instead of doing that at a conference, there's ways for us to do that every day. We just probably didn't think about it that much.
That's great advice. What else can you give us in regards to trying to keep sane? Because we've got those stresses at work, but a lot of us now have stresses at home as we're trying to homeschool our children and deal with the hoarding at the grocery stores. Yeah. What advice can you give to the veterinary industry and professionals on how to keep that balanced?
That's, it's going to get harder, right? Because our not only did our stresses that were already there still there, but now they've changed too. And we've added new ones. And like you said, family stress very much changed, and it's changed for everyone lately, from not being able to see relatives and lean on that contact to new things. But again, the good news is there's a lot more resources online than I think we've all realized in the past. So it's time to start exploring. And Not One More Vet has great resources. There's some great communication classes from Mighty Vet that can help you through some professional stress at this time. Remember, again, Vetfolio has a nice health and well-being center that's free. And then another person that I want to bring your attention, if you've heard of Dr. Nadine Hamilton, she's a psychologist from Australia who specializes in veterinary well-being. She has even moved some of her well-being sessions online, things that she had been, I just emailed with her yesterday. She had been too busy to do online sessions for a while, but now, since she's going to be home for quite some time, she's doing online well-being sessions. And there's a lot of folks that are going to offer more things like that. So remember to keep those things on your CE list too, or just even on the, on your regular list. It's time to take a few minutes for yourself too.
Dr. Varble, thank you so much. Those are wonderful resources, and thanks for all you're doing to help support the profession right now at this difficult time.
Thank you. Keep it up from you too. Okay, everybody stay safe and healthy.
Dr. Justine Lee is a board-certified emergency critical care specialist and toxicologist. She's also the CEO and co-founder of VetGirl, which provides online veterinary continuing education. Thanks so much for being with us.
No problem. Thanks for having me.
So we're kind of in survival mode right now, right? So we're trying to continue to be working professionals, and then also as working parents, and now some of us are homeschooling our children for extended amounts of time and dealing with that stress. Let's talk about some tips we can give to the working moms and working dads out there that are really trying to gain some kind of perspective and balance and reduce their stress as much as possible.
Sure. Well, first of all, hats out to anyone who's out there trying to be a working parent. I know one of our sister veterinary clinics is closed down, and everyone's just really overwhelmed and really stressed about the whole thing. My daycare has been closed down for about a week, and it is honestly not our job to completely homeschool our kid. So people do that all the time. But during this time of emergency, the biggest tip that I have is cut yourself a break, because honestly, it's really hard to balance trying to get your small business to survive, keeping your family safe, keeping them entertained. If you could do 1 or 2 hours of educational content, great. But the rest of the time, I'm going to say, is really just survival mode. So again, cut yourself some break. I would say a couple of tips, and I included this in this blog that I wrote on VetGirl called Things to Do for Kids and Parents in Social Distancing During COVID-19, is splurge in areas where you wouldn't normally splurge. I admit we just bought a $250 bounce house. And the main reason why is because we just survived 6 months of Minnesota winter. And this was the time we were getting ready to go outside and, see our neighbors again and go to zoos and things like that. And now everything's closed. And so So for me, it was splurging to let my kid just physically burn out some energy, using resources out there, getting creative, whether or not it's making homemade slime or buying more coloring books. There are a lot of resources, and shout out to all the awesome companies that are providing free services right now. I know this is for both parents and for kids. So Highlights, Brain Pop, Prodigy Game, readingeggs.com, Zern.org. These are a lot of fun activities you can have for your kids. Khan Academy, there's a lot of non-veterinary CE out there, free MOOCs that you can get out there for yourself too. Even certain things like Peloton. Peloton, if you don't even have a bike, but you have a treadmill at home, or you want to meditate, you want to walk, you want to get some exercise when your gym is closed, they just extended a 90-day trial membership. So great opportunity when we're probably going to be trapped at home for a couple more weeks to months. Again, so utilize those free learning opportunities out there. Scholastic.com has just expanded to a bunch of virtual field trips. Get a couple of hours of learning experiences there. Adventures of Odyssey, which is focused on the family, also has something like that. There's a lot of great ideas on the internet, a lot of great virtual field trips to go to the San Diego Zoo or to Mars, or animal cameras, or virtual farm tours. I actually used an online story time from our St. Paul Public Library, where it was our librarian who was doing a story time in isolation from the library. Remember, you can still go outside, and I'm going to advocate everyone should still be obeying the social distancing, but you can still get outside. So take your dog for a walk, make sure you're getting outside, throw a soccer ball around or football around, get out in nature. We just went to get a little hike in. We had an outdoor picnic. Your dog will love it too. So definitely take time to do that. Utilize YouTube. Dance Party Freeze or Dance Freeze Party, whatever it's called. Bake more, make paint, do fun things. Unfortunately, we're going to be trapped at home. We really don't know if it's going to be for weeks to months. And we know that we are considered essential when it comes to small businesses. So we oftentimes do have to stay open. I know in the Twin Cities, a lot of local referring veterinarians have shut down, or they are no longer doing elective procedures in an attempt to preserve PPE based on recommendations from the state. And so our specialty emergency clinic has been super swamped. So I'm also going to say during this time, please make sure that you have good self-care. This is really important. I go through periods when I'm tachycardic about COVID-19. I'm really stressed about it, and I'm trying not to be. So my husband and I have a sort of a 5-minute strategy in the morning and the end of the day of what we're doing for ourselves, how we're trying to view this from a positive light. I will say there are a couple of positive, awesome things that are going to come out of this. And one of them is the incredible amount of quality time that we're going to have with our family. We typically don't spend 24/7 for weeks at a time with our family. So that's one good thing. I always joke that we're on social media or technology too much, but this is an opportunity for you to FaceTime or Skype or use technology to connect with colleagues. I know people are having like virtual happy hours just to connect to some friends. Really important that we take care of ourselves that way. I also think both human and veterinary medicine, they're going to get huge shout outs after we survive this pandemic. Animal Emergency and Referral Center, the hospital that I work at, we just loaned our ventilator to a local Twin Cities human hospital. And that's because there's so much need. A lot of people in the American College of Veterinary Emergency Critical Care College have actually loaned their ventilators out just to help. And a huge shout out to all the human medical professionals, whether or not it's EMTs or paramedics who are exposing themselves and putting themselves at risk. But same thing with vets and vet techs and CSRs and tech assistants. They're all on the floor. So the biggest thing is take care of your family, but cut yourself some slack. This isn't homeschooling time. It's quality time for us to keep ourselves safe. Make sure you take care of your colleagues, that you social distance, and more importantly, that you take care of yourself and just your mental health right now. Whether or not it's, getting some more exercise, making up routines, using YouTube to do stuff like that. But utilize technology at this time while we're all quarantined inside.
Such wonderful tips. Dr. Justine Lee, CEO of VetGirl, thank you so much for being with us.
Thank you.
Dr. Tony Pease is the Chief Veterinary Officer for the Viticus Group, formerly known as WVC. Thank you so much for being with us.
Oh, thanks so much for having me. This is awesome.
You know, Dr. Pease, first of all, we want to thank you for helping us gather all of the important veterinary leaders from the Viticus Group and NAVC, AVMA, AHA, and so many others. Why is it important that the industry is coming together like this?
Well, you know, it's interesting right now. There's so much misinformation online, and everywhere that you look, there's just so much conflicting information going back and forth, not just for the public, but also for the frontline, basically public health sector, both veterinarians as well as the human health providers. And so we feel that it's really important to have one unified voice between the industry, and we would really make sure that this platform is going to be that voice.
Totally agree. Now, within the Viticus Group, you know, you are a leader in hands-on learning at the Equendo Center at Las Vegas. And unfortunately, where we are right now, without any ability to travel and do a lot of these sessions, we've had to really adjust our ability to learn. So what is the Viticus Group doing to adjust to the changing times?
It is so true. And I mean, nobody could see this coming, but the whole point is that nothing really replaces this hands-on learning, which is what the Viticus Group is really focused on. But honestly, really when it comes down to veterinary training as well, and even when you think about the human health training, we can't learn the education that we are doing online. Like it is one component to what we need to do, but we have to figure out ways to make sure people get the experience and be able to make sure that they are learning. So we are working with all of the industry partners, not just AVMA, but also the deans in veterinary colleges, and try to figure out ways to just supplement the online college content. We are very fortunate that there is a lot of online content out there. But again, as we mentioned before, not all of it's accurate, not all of it's done very well and professionally. And so as the Viticus Group, we are, you know, so fortunate to have 92 years of history as WVC that we have a lot of the online content very professionally done, and looking forward to figuring out ways to make the hands-on experience, even if it's small group settings, or trying to figure out what that looks like in the future. Because unfortunately, I don't see a way at this point to replace any sort of hands-on, but what we will have to try to look at is ways to make it so that it's safer for everybody, and try to figure out ways to even bring hands-on learning to participants.
Yes, very well said. And, you know, we're talking about when we're going to get back to normal. I don't know if anybody knows what our new normal is going to look like. So what has this pandemic done to really change the way we think and tackle these challenges ahead? What do you think we're going to take from this?
Well, I think the biggest thing that we'll end up taking ahead is just how, as you talked about, unprepared the educational system was. I mean, even if you think of our CE requirements as veterinarians and veterinary technicians, we need to figure out ways that online is going to become much more kind of pivotal in that role, but also how we adjust to almost this new normal. And so this is going to be something that, working with the AVMA and working with also the veterinary medical associations throughout the country, we're going to have to try to figure out how Viticus Group, and with our facilities and everything of that nature, how we end up kind of moving forward so that we can make sure we're providing educational opportunities in the safest method, not just for the participants, but also for the educators. And that's really what we're going to be kind of working on. And that's what's so exciting about this whole forum. As you can see, bringing all of these industry experts together, talking way through it and figuring out ways that we can move forward, because business as usual is just not going to be it. Who would have thought that we'd actually shut down major cities and not have this sort of interaction of less than 10 people? And that's really what has changed. And that's what we have to really look at, that's going to be a game changer for how we teach veterinarians, human health professionals, and how we move forward.
And unfortunately, we're running out of time, but anything else from the Viticus Group in regards to advice or guidance to the veterinary professionals on the front lines right now, where there's a lot of uncertainty and fear and anxiety, and we're really looking to the leaders of the profession for some guidance?
Absolutely. I guess the best thing to tell you is that you're not alone. We are all here together. We are working tirelessly. We're not just sitting at home kind of socially isolated. We're figuring out ways to help you that are seeing all the patients, that are seeing all the cases, and trying to figure out ways to make sure you have the best information, the most accurate information, and the best skills to provide treatment for all of the pets out there, but also trying to work, we're uniquely situated that we also help the human health profession as well. So we're also working with human health professionals. And that's this One Health idea that's going to bring us all together, because veterinarians are uniquely situated to help the human health professionals and vice versa. So we're going to tackle this together. And I think the whole point is to realize it's not just veterinary medicine and human health medicine. We're coming together as a global community to make sure that we move forward and we're better prepared in the future. And Viticus Group is standing by you to make sure that you have the best quality information in the future.
Dr. Pease and the Viticus Group, thank you so much for your guidance, support, and for bringing all of these professionals together. We really appreciate it at this difficult time.
Thank you so much, Dr. Marks. It's great talking to you.
Tasha McNerney is a certified veterinary technician and the founder of the Veterinary Anesthesia Nerds. Thanks so much for being with us.
Thanks for having me.
So in the profession, especially with the veterinary technicians, we've been talking a lot about the stresses they're dealing with. And then along comes COVID-19 pandemic and throws everything up in the air. A lot of uncertainty and worry and concern. But you, as a leader of the veterinary technicians in the industry, you've got some helpful tips and guidelines for the technicians to stay as physically and mentally healthy as possible. Let's start with one of them.
Okay. Well, the first off, I think, and the most important is to be safe. Like, just overall be as safe as you possibly can. I know it's said like a million times, but hand washing is so crucial. Keeping safe distance from people and limiting your interaction with people, limiting the amount of times you have to leave your house to go to the grocery store, planning trips out to make sure that multiple people in your household aren't going out. When you're in the clinic, limiting your contact with clients that are coming in, but also other staff members. Make sure you're trying to, as best as possible, follow that, social distancing. It's hard, yesterday I was in the clinic and I'm trying to help to restrain a dog, and, another technician and I are very close to each other. So there is that awareness now of how far away am I from someone, and can I move a little further away to give them some distance? But also clients that are coming in, just be aware, use the screening questions before clients come into your building, or even if they come into your building at all. At our practice, we're utilizing more telemedicine. We do curbside check-in, so no clients are actually allowed in our building unless it's a euthanasia. So I think that helps as well to limit the amount of face-to-face interactions you have with people.
And you've also got some thoughts about technicians being proactive about their job itself, right? And their financial security. What advice would you give there?
Man, it's just so tough. And I kind of went on, Anesthesia Nerds yesterday and just said that it's going to suck. Like, there's no sugarcoating this. There's no easy way to get around this. Clinic owners are in a jam, but clients are in a jam as well. They want to get the care. But the reality is that a lot of clinics are going to have to lay people off. I mean, even at my own clinic, we laid a ton of staff off just to prevent unnecessary exposure of staff members. And so if you feel like that might be coming, I urge you to take a look at the programs that are available. Call your student loan service provider, call your car loan service provider, call your mortgage company. A lot of them understand the realities that a lot of people are facing, and a lot of people are being laid off of their jobs. So be proactive with that. Get it lined up so you know how long you can put something in deferment or forbearance to ease it a little bit on your family if you should have to go on unemployment. And then also look at the unemployment programs that are available. Get ready with your paperwork if you think you're going to have to go that route. So that way you're not scrambling to find papers that, you want to save as much time as possible and get whatever benefits might be coming to you.
And it's hard to think about, but we appreciate your transparency, and it's things that we need to do, just like you said, to be proactive. So preparing for what could be ahead. We want to, though, give some of the technicians some positive lights. I mean, we have enough stress, and we're both working professionals and parents, right? What are some things that you're doing to try and find some positive energy through this really challenging time.
I mean, I'm still working in the clinic, so I think that there's two challenges, right? There's challenges for the people who are working in the clinic and working through this pandemic and working in close proximity to people and possibly being scared of exposure. But then there's also the stress of the people who may have been sent home and are now under quarantine at home and can't leave their homes and going stir crazy there. So I think there's different stressors at play, and just having some self-awareness is going to be really important in this. If you feel like you're in the clinic and it's just too much for you, or you might be picking up too many shifts, just remember, you don't have to pick up every shift that becomes available. You don't have to work a 12-hour day if it's too much for you. Take some time, be at home, limit your social media, right? Because social media, the only thing people are talking about on social media is all of the terrible things that are happening with this disease, and you don't want to be just surrounded and inundated with it. So if you can, distance yourself from social media, limit the time that you're on social media, and use some productive apps. Headspace app is a really great one. Calm app. Headspace app is actually doing a free membership for healthcare professionals. So if you can prove that you work in healthcare industry, there have some free programs there. Also, a lot of employees or employers, have assistance programs for mental health and some numbers you can call. So utilize those programs. I personally have Spotify. So Spotify has quite a few guided meditations on there. So just take 20 minutes of your day, kind of recenter, zone out with a guided meditation, and don't focus on all of the negative. Spend some time outside if you can, do yoga. But one of the things I really, really think is important, it's great that we all have toilet paper in our cabinets, but make sure that you're eating healthy at this time too. Take your vitamins, make sure you're taking any supplements. I really think with this virus, and this is own personal opinion, I'm not an immunologist, it probably is just a matter of not if we're going to get it, but when we might get it, or when somebody we know might be affected by it. So make sure your immune system is as healthy as possible and you're taking care of yourself in every way possible.
Tasha, thanks so much for your time and your leadership. We really appreciate it.
Thank you for having me, and stay safe, everybody out there.
Dr. Warren Hess is an assistant director in the AVMA's Division of Animal and Public Health. Thanks so much for joining us.
Great to be with you today.
Thank you. And I know the AVMA has been hard at work advocating for the profession right now, especially in the area of making sure we are all named essential businesses. Can you talk a little bit more about that?
Yeah, this is an interesting problem. Obviously, we are an essential business. The problem comes in that local jurisdictions are making these orders. So either on a state or a city or a county level. And initially, they just didn't think about veterinarians, and so they didn't even mention them. That's when we went to work to make sure that we were getting the message out. We've developed talking points on that. We've sent it out to all of Congress, to all governors in every state, to help them understand that don't leave us out, because people just become confused if we're left out. We're not aware of any location that has intentionally dictated that veterinarians are not essential businesses, but we've worked really hard with that. And also, the Department of Homeland Security just came out with a model list, I believe 2 days ago, and veterinarians are also listed on that list as well. So it's more a matter of just getting clarification. Sometimes we're tucked away in some of the small print in some of these documents, and people just need to look. But as far as we're aware, this should not be an issue. And if it is, then probably a few phone calls will solve it.
That's good to hear. The AVMA is not only advocating, but again, putting out a lot of information for us to practice in a safe manner. How is the AVMA doing this, and what helpful tips can you be giving to practitioners and other industry professionals right now to make sure they're staying safe at work?
Well, this is an opportunity, I believe, for veterinary medicine to shine. It's easy to look at it as a burden, which it is, but there's always opportunities where there's severe challenges, and veterinarians are perfect examples of One Health practitioners, and so we need to move forward. I would also just say that veterinarians are well trained in making risk decisions every day on our patients. What might be the benefit of a certain procedure, what might be the downside of a certain procedure. And that plays right into everything we've got to deal with. So we have resources on our webpage that we've put up on ideas on social distancing in practice, how to do a workflow through a practice as animals come in from different potential risk levels. We've got information out there for house call and mobile practitioners because they're going into homes on a regular basis, and we want to make sure they're protected as well. We've got information out there on preserving PPE and how to go about that, and situations in which you can consider reusing PPE.
These are all great tips. We're very, very thankful for all the work AVMA is doing to help support the profession. Is there anything else that you want to address today?
I just want to say this is a time we need to pull together. It's a great time to make sure you're tuned in to not only AVMA, but your local state veterinary medical association, and working all in conjunction. Look forward to continued information coming from us. And if you're not already, follow us on Twitter and Facebook.
Thank you again for your time today, Dr. Hess. We really appreciate it.
Hey, thanks for all you're doing.
Dr. Kelly Ballentine is a board-certified veterinary behaviorist in Chicago. Thanks for being with us.
Thanks so much for having me.
We want to get right to it, Dr. Ballentine, because a lot of our veterinary teams right now, with as much uncertainty and stress, are also getting concerns from clients about behavioral changes that are happening in their home, right? And so I know that you have a lot of great tips for us to give to our clients and for our teams to make sure that we're supporting their behavior concerns and needs as much as possible. One of the things that we talked about originally was if we are talking to clients and they see behavior changes happening in their pets, we need to be giving them some guidelines. What do you suggest?
Sure. Well, one of my first guidelines is to make sure you're evaluating that pet's physical health as well, because as we all know, behavior changes can be a sign that there's something medically awry. And it's possible that these pet owners are just noticing it now that they're spending more time at home with their pets. So if it's at all possible, I'd recommend having that pet come in for a physical exam and a further evaluation.
And I know as a parent of 3 young children, all of the teachers right now are saying to keep our routines as normal as possible and as consistent as possible. Is that also important for our clients to be doing with their dogs and cats?
Yeah, absolutely. So, these pets might be experiencing more anxiety because now their routine is completely been thrown out the window, just like our routines have. So while there's not much we can do about having to stay at home, we can control the things that were kind of normal patterns in the dog or cat's life, such as their feeding schedule or their walking schedule, and also giving them some time to just kind of be on their own as they would if their pet owners were out at work.
And there are some positives that we can take right from this for our clients that maybe are spending a lot more time at home with their pets. What are some things that you're giving guidelines to veterinary teams to tell their clients, let's make the best of this? What are some things they can be doing with their dogs and cats that maybe will bring some light into their house?
Yeah, absolutely. So one of the things I would recommend is, to use that time to teach that dog or cat a new trick. And I specifically recommend trick training because it's fun. It doesn't take a lot of time. So it's something that you can usually just practice a couple minutes a day. And it's a great relationship building activity. So it helps to strengthen that bond between that pet owner and their pet, and something that would be sustainable to maintain once, the pet owner's routine gets back to normal.
And there's going to be clients that no matter what we try over the phone are still going to have some challenges right now. You mentioned anxiety is on the rise, and there are a lot of dogs that are in the midst of reactivity training and other things that now have been canceled, right? And they're
Right.
feeling stuck. And veterinarians and teams might feel stuck. I know you have some options, though, for veterinarians and their practices to reach out to behaviorists in a different way.
Yeah. So absolutely. So a lot of veterinary behaviorists offer teleconsulting with primary care veterinarians. This is something that we offered before the crisis and something that can be definitely utilized now. And so it can be a really good option. You know, there are other forms of support, and we can assist you even while staying at home.
Any other tips for teams or to be giving to our clients to try and make as much normalcy out of this new normal that we have?
Yeah. So I think one thing to keep in mind is to plan for the future as well. So once you go back to work and aren't spending as much time at home, that's going to be another big change in your pet's routine. So make sure, you do take some time away from your pet, that when you leave for the grocery store or something like that, leave your pet at home so that they continue to be accustomed to that as part of their normal life.
Great tips, Dr. Ballentine. Thank you so much for being here.
Thank you so much for having me.
Steve Dale is a certified animal behavior consultant and a longtime pet journalist. Steve, thanks for joining us today.
Yeah, tough times to join you, but I'm always happy to talk to you.
Us as well. And we really know that you have a pulse of what's going on within the pet owning community. What are you hearing about the worries and fears and concerns of pet parents today?
So the question I'm hearing first and foremost, and I'm hearing a lot of questions, is when do I go to the veterinarian? When is the time right for me? And I'm telling people, really, it depends on where you live, because some communities have more issues than others. Some have veterinary clinics that have volunteered to kind of say, all right, we're going to respond in this way. And by the way, the veterinary profession, Dr. Marks, I think has never looked so good. Instantly when this happened, it's as if veterinarians all over the country emailed one another and said, we know what to do. And that's because I think veterinarians are really well prepared for this sort of thing. Not this thing in particular, of course, but you're educated in One Health, right? And you're educated in disease prevention and understand inherently what to do. And I think pet owners are beginning to understand that, which is a really good thing.
I agree with you. And I think that a lot of veterinarians are taking initiative to take care of their teams and to take care of their clients' safety, but also try to see as many patients as possible. How are pet parents reacting to some of the changes that a lot of veterinary practices are making to have these protocols?
I think people understand. I think that people are incredibly grateful that veterinary clinics are oftentimes in communities that have been pretty much shelter at home, for the most part, considered essential businesses. And I think that's really important. And I'm grateful that our government understands that. Maybe our government has learned lessons from past experiences, different experiences like Hurricane Katrina. But when you don't consider companion animals, everyone pays a price, not only the companion animals, but the pet owners and the community as well. And I think that governments are at least beginning to understand pets are part of the family. Part of that is that those people in government oftentimes have pets themselves. So I think that's very important in of itself. Veterinarians are superstars and have been careful, yes, appropriately so, about how they do what they're doing. But I know that people are grateful that you continue to be there when you're needed, and you are needed always, and it's not only those emergencies, think about it, a rabies vaccine. What if that pet is due for a rabies vaccine and we get below the bar in vaccinating our pets for rabies? I'm not suggesting that is about to happen, but there are many, many reasons why this is important. Zoonotic disease, leptospirosis, for example, right? So here is something that potentially we could get, and veterinarians are saying, we will still do what we need to do.
Well, we're definitely all trying, Steve, and we thank you so much, as always, for your continued support of the profession. Thank you.
Well, we love you. Thank you.
I want to thank everyone who participated today. I must say, I've been a practicing veterinarian for almost 20 years, and I'm most proud when our profession comes together for the greater good of everyone. Please make sure to visit the web pages of these groups. We will be working hard to continue to provide the latest information and resources as we work together for a better tomorrow. I'm Dr. Natalie Marks. Stay safe and healthy.